Hello everyone. Good evening. So please let us know in the chat box if the audio, video, everything is good. And hope all of you are staying happy, healthy, and studying well. So yes, let's see who all are there in the comment section. Give us a hi. Okay. Right. All right. So to all dear students, time is precious. So we'll keep this session short and sweet. And today, the agenda for the session is to discuss on revision. Okay. So I've got the ACE faculty of Obstetrics and Gynaecology of Doc Tutorials, the vibrant Dr. Gayathri with me. Gayathri, good evening.
Good evening, sir. Thank you so much, sir, for the kind introduction.
Good evening. So we'll just give you some of our insights on planning your revision. Okay, we'll keep this session, as I said, short and sweet. First, I'll just talk about how to plan medicine revision. After that, Dr. Gayathri Madam will be talking on planning OBG revision. Meanwhile, you can ask us your queries. We'll be happy to answer that. Okay, right. Let's get started. So first, I'll just talk about planning medicine revision. So what I just want to tell you is that, look, medicine is a vast subject. And I'm sure that many of you are probably in the middle phase or late phase of your exam preparation. And if you are a candidate realistically planning for the INI-CET May examination, you should get your portions over by maybe Feb at least, so that March and April you can devote for revision. At the same time, if you are a late starter and you're not seriously planning for INI-CET, well, you can keep NEET PG as a target, but I still would urge all of my dear students to give the INI-CET exam, because as of now, we do not have a concrete date for NEET PG. The only exam that is certain to happen is the INI-CET in the month of May. So I think, you should keep that as your first target. Okay. Because even if you don't crack INI-CET, suppose if you tell yourself, sir, I don't think I'll be able to crack this, but still if you target INI-CET, I'm sure that you will pick up the necessary momentum so that you can move forward and crack NEET PG with a good rank itself. Okay, right. Now, with regards to medicine, I just want to tell you, when you plan your revision for the subject of medicine, I'm again talking about candidates first who are preparing for INI-CET May. Okay. Now, the mistake many students make is like once they start revision, they go for a line by line read of their notes. So by notes, I mean, if you are an online live batch student, maybe the notes that you have made with your workbook, or if you are watching pre-recorded lectures, again, the notes that you have made or the hard copy notes that you have got, or if you are a face-to-face batch student, again, the workbooks that you have got. So once you are done with your notes, please don't think that it is possible to go for a thorough line by line reading for, the revision. I'll just tell you some areas to prioritize. Okay, I've just listed it down. Number one, you have to focus on previous year topics. Now, once you are done with the first read of medicine, in the round of revision, please prioritize PYTs. So when I say PYTs, please go through the last 5-year questions asked in INI-CET, at least 3 years. 5 years, but at least 3 years. And you try to identify topics that have been asked. Now, this will definitely help you because INI-CET, unlike NEET PG, is a bit more predictable. Even Dr. Gayathri would agree with me that, she is also an AIMS product. And it is basically, about identifying the pattern of INI-CET. And for that, if you look at the Doc Tutorials app, we have got all the questions as well as we have got the recall videos as well. So it's important to be aware of the previous year topics so that you can also predict, okay, I think Brugada syndrome has been asked. So it is important to know a few points regarding the inherited channelopathies leading to arrhythmia. So you can yourself predict certain questions. Okay, so number one, please focus on PYTs. Number two, I'm sure you're giving the grad test, right? Make sure you correct your mistakes. Now, many students, what they do is like they try to make their stronger areas stronger and stronger again. Meanwhile, the areas that they are weak at, they often neglect. Please don't do this. You have to understand that if at all you have got weakness in maybe certain systems of medicine, maybe your understanding of cardiac cycle or the antiarrhythmic drugs or arrhythmias, if you have got any sort of weaknesses, you have to sort it at least by Feb end. March and April, you can devote entirely for revision. Very important. So I think going through the GT mistakes and writing those topics down, even during my preparation, I had a mistake book where I would jot down points so that, I would not actually repeat the same mistake again and again. That's what I want to tell you. Next, third, and very important. Okay, so I've told you about the PYTs. I've told you about the GT mistakes. Number three, high yield but volatile topics. Very, very important. When you go through your notes for revision, I am sure that you know certain areas from which questions are frequently asked, the idea of which you will get from the PYQs, and certain areas will be volatile. Now, certain areas, you will already be thorough. No point reading that again and again and again. It's about identifying the high yield but volatile topics and then, revising it a couple of times so that you don't forget. Very important. So these three things are must, and these three things should dictate, your revision. Important. Now, it's also important not to overdo. Many a times, a mistake that happens during the revision phases, you tend to spend too much time. Remember, medicine is vast, but remember, medicine is one among the 19 subjects. Sometimes, you tend to overdo, like you tend to read, you tend to just, dive more into that particular topic. Well, you will have to restrict yourself, you will have to prioritize. So don't overdo and never aim for perfection. If you want to aim for perfection, or at least you want to target perfection, take medicine for post-graduation and welcome to the medicine family. That's what I want to tell you. Okay. And revision is not rereading. Sometimes, again, what happens is, when you revise, you keep on reading line by line. If you've got certain areas where, you tend to forget maybe certain monoclonal antibodies, drugs in bronchial asthma, just don't passively go through it. You try to recollect, okay, what are the drugs that act on interleukin 5 receptor? Try to recollect. Otherwise, you're likely to, miss the same point again and again, right? Okay. And don't leave a system again. Sometimes you might say, sir, I don't like cardiology. Whether you like or not, I did not like PSM, but, it's very important. So don't actually leave a system or leave any subject like that. You will have to give importance. So these things I just want to tell you on certain do's and don'ts. And just one more point before I actually go to Dr. Gayathri ma'am is like from where to revise. Okay, so what I would like to tell you is for medicine, you would have already seen that in the doc tutorials app, you've got QRP videos. These are short, crisp revision videos, 5-minute, 3-minute, 6-minute videos of topics, which you can just watch, just you take a little walk and you play that 1.5x and you can finish it in 2-3 minutes. They're very crisp, ultra crisp revision videos. Because what I want to tell you is, again, don't go back to main videos. If you've done with your notes once, then it should be just about going through the revision videos. I think QRP videos should actually help you. So, and again, make sure you don't miss my recall videos, because in my recall videos, not only I discuss the particular question, but I just also try to have some assumptions on what a future question can be. So do not miss out on the revision videos. These are my preliminary, inputs that I just want to give you. And regarding medicine, on planning for medicine revision, again, I want to tell you, stay calm. We're not here targeting for perfection, because you've got 19 subjects and it's not that easy to master everything, and it's not required as well. But please plan and prioritize. And coming to Dr. Gayathri, I think you will be eager to hear from Dr. Gayathri much more than me, primarily because of the reason that OBG is a subject. If you learn well, you can have 100% strike rate. Okay, but you have to learn well, and I think Dr. Gayathri is the best person to guide the students on, how to have almost a cent percent strike rate in OBG. The subject is vast, but how can you concise, especially with the exams coming by, maybe the INI-CET, for example, Dr. Gayathri?
Thank you so much, sir. Usually, as sir rightly pointed out, OBG is slightly vast, not as vast as medicine maybe, but it is vast. But the best thing about OBG is once you learn the whole thing, you can have a very good strike rate. And on top of that, we are getting nearly 30 plus questions every time from Obs and Gyn. So you will master it. It's going to be very helpful. And if you look at the trend of the recent questions, either they are asking from very basic things, or they are usually asking the management aspect of it. Let me just give you an example. Everyone knows that you get this face to pubis delivery with anthropoid type of pelvis. Nowadays, what they do is instead of asking that as a single one-liner, they will just club two information. They will give you an image-based question. They will just give different types of pelvis images. Along with that, they are going to ask this. So usually this is one pattern we have been seeing for the recent years. Another example is like twin pregnancy. You have this twin pregnancy. How will you deliver? If the first twin is cephalic, you can go for vaginal delivery. So instead of asking this as a direct thing, they often put an image of it. One for the first baby is either cephalic or maybe it is in transverse. Like, so nowadays we see this very core basics converted into more of clinical with image based questions. That is one thing I definitely want you to focus upon. Apart from this, nowadays you will see that they are focusing more on the management aspect, and the clinical core aspects are heavily emphasized. Just taking the example of last year NEET PG exam, majority of the questions from obstetrics were from obstetric emergencies, such as management of postpartum hemorrhage, the cord prolapse management, placenta accreta spectrum management, uterine rupture. All the emergencies are covered, abruption, all the emergencies are covered in detail. So I would say always in obstetrics have a very good emphasis on all these clinical management aspects. Just in the PPH, in all three exams last year, there were 3 questions, 2 INI and 1 NEET PG question just from the topic of PPH. Shoulder dystocia was repeatedly asked. So I would really ask you to emphasize on those obstetric emergencies. At the same time, don't leave the very core basics as well, which is often asked. In gynecology, like oncology is very important, especially CS, cervix, all those areas. Definitely you can expect 1 question totally from oncology. Last time NEET PG we had total 4 questions. So oncology is a must know topic. PCOD, polycystic ovarian syndrome, often they give a very basic topic from this. That's very important. From prolapse, we often get, especially from the management aspect, there is 1 question. Vaginitis, definitely you will get 1 question from vaginitis, especially for the NEET exam. When you take the antenatal surveillance, you will notice that especially INI focus on that biophysical profile, manning, all those things are often asked as this. So in every subjects, there are some areas which often gets repeated. I would say there is 20 to 30% areas from which 80% of the question do come. So first of all, once you're starting to prepare, leave that perfectionist attitude from your mind. Okay, all of us have the tendency to read from cover to cover, from the first page till the last page. First of all, you have to let go of that perfectionist attitude. You have to be absolutely thorough with this 20 to 30% or what are the core areas there. Then you can go as laterally as possible. You can go till the PG level also, but stick to your resource, be very thorough with these areas. Now some of you might be having this doubt, whenever it is very vast area, how to focus upon. I often used to use the retrograde approach. That is, rather than reading one topic completely, I used to go through the questions roughly first. Now I would know from where the questions are actually coming, then read from that area. Now the brain is actively looking for those information which is related to the question. Now your job is not done. Once you have done that, you have to come back to the question. So initially just go through the question quickly, answer it. It may be wrong, as so many things you might not have learned. It might be wrong, no problem. Don't judge yourself or don't let it affect your ego at that point of time. Just go through the question, try to answer it with common sense or as much as possible, then go through those areas actively. Now come back to the question. Now you would see that even though you have read that area, some of the questions might still go wrong. Now we'll understand usually there is a thought process which is going wrong in those areas. Many times I used to miss this all except word would have been missed or something like that. There are some areas which we still miss afterwards also. So you have to come back to the question, and as sir rightly pointed out, you have to start making your mistake diary right now itself. Many times we see that there are some mistakes which get often repeated. Like first time maybe you had made 10-20 mistakes, next time there is a probability that you will repeat 50% of them again, because in one go maybe that rewiring of that wrong circuit which initially happened does not happen in one go. So always maintain the mistake diary. I want you to maintain two books right now. One is the mistake diary, second would be your 20th book or volatile book. This is going to greatly shift your rank. You have to have that book. Just give you an example, we had this question on bishop score. I'm sure that students would not revise the bishop score few days before the exam. They won't remember how to calculate the bishop score as such, because in residency we are doing it daily. In UG level we see it, there are so many values in it, we often tend to forget it. But if you have this volatile diary where you have very volatile information written down and you revise it in the last 10-15 days, that's going to greatly shift your rank. Because practically in the last days we are in a lot of stress, lot of confusion is there, what to read, what not to read. So right now itself, when you are doing your revision, like at least as sir rightly pointed out, in the next 1 to 2 months complete whatever pending topic is there, then go on to your revision. As you are revising itself, just keep a paper or maybe a book besides you. It need not be very aesthetic, you can just scribble it down like some things which are very volatile, or even take a screenshot, keep it in your mobile so that you can go through it in the last 10-15 days. Plan your last 10-15 days now itself and give a very genuine attempt for the INI exam. Don't think that I will go for the NEET PG, I will finish everything, all those things. It's okay. Whatever is there, target the INI. At least it will act, maybe there's a good probability you will get in. If not, also it is going to act as a good GT. It will help you to understand where you stand, what all areas you have to improve, which is again going to give you a great edge for your NEET PG preparation. So in this INI itself, you have to plan for the last 10 days, this volatile books and all. And by the time you are appearing for NEET PG also, this will become much refined and help you much better for the NEET PG exam as well. So I would say you have to maintain this mistake diary as well as volatile book and start practicing the grand test right now itself. Many times we have that tendency to finish everything and then go for grand test. I would say if you have completed at least 50% of whatever syllabus is there, start doing grand test. Maybe there'll be a lot of mistakes that happen, and utilize the next 1 to 2 weeks to analyze what the mistakes were. The next 1 week you can analyze for the mistakes, and maybe the next week, which is there, to go through the core areas as is. Minimum thing I would say, you have to analyze your mistakes and understand where the mistakes were, or maybe maintain it the mistake diary. And if at all you are seeing that there are some things, either mistake could be something which is very factual. If it is factual, I would say maintain it in your volatile book and read it in the last days. If you see that your mistakes are mainly conceptual, go through the revision videos, and if at all still the concepts are not clear, only for those topics you can go to the main videos as well, try to clear those things out. If you see that those are silly mistakes, then you should understand why those mistakes actually happen and try to correct it next time. So always analyze your GT thoroughly, and that will also give you an advantage, because finally whatever you read, finally you have to be ready for an entrance exam, for an MCQ based exam. And MCQ solving is a skill that only comes with practice. It's not enough just keeping on reading. You have to do MCQs, you have to practice it and do it in an exam simulated way, because a lot of questions you are doing together, our mind also gets fatigued. So you have to practice in that long stretch. Start with 50 questions, increase your mental stamina to 100, maybe 150, 200, gradually build that up. For example, I ask you to run a 10K tomorrow. Very few will be able to do that. Similarly, for our mind as well, you will not be able to like concentrate in a stretch for maybe 200 questions in a stretch. You have to practice that. So start practicing it right now itself. Maybe at this point you can start with every 2 week 1 GT or every 3 week 1 GT, that's okay. But as the exam approaches, I would say 1 GT per week would be a good go for it as such.
I think very useful insights, Dr. Gayathri, and I just want to echo two of your very, very valid points once again to the students. Number one is to plan the last 10 days before the exam right now itself. Now you have to ask yourself, like, what am I going to do 10 days before INI-CET? What resource, what notes you're going to revise in that time? That is very, very important, because I have seen many students preparing so well, but the last couple of weeks, how to handle, the notes, how to summarize the notes, if you are all able to do one capsule solid revision in the last 10 days, a mini revision, I think that is immensely going to lift your confidence going to the INI-CET. So that is point number one I want to reiterate. Point number two is to do GTs without fear. So recently, when I was taking the interview of one of the INI-CET toppers, he just told me, sir, I was so regular in my grand test, so regular in that, on the exam day, it just felt as if, I was just giving another grand test. You have to actually, give yourself such sort of a match practice, because I see many students just keeping on reading and reading, thinking that, sir, I've not done this topic, maybe once that is done, I'll do the GT. Remember, the actual test is the grand test. So you have to give grand test, have a proper plan, and then prepare accordingly. That is what I just want to, tell all of you. We'll just take a few, quick questions from the students. One student was asking, is 8 hours. Now, these questions, all of you, dear students, listen to us, because I'm sure that these questions, some of you also would like to actually clarify. 8 hours, is it enough on a day? Well, I always tell my students, it's not that I don't equate the study hours always to the productivity, but for such a competitive exam, you will have to give, I think, a bare minimum effort. So what I think is, look, we are, past the half of Jan. So I think we are ready to go to the sprint phase in case you're preparing for INI-CET. I think you have to give at least 10 hours. So count from 10 onwards today. From today, every day from today, try 10 plus hours. If you're doing already 12, 13, just keep being consistent, but consistency is the key. Well, you might have a few odd days here and there. That's okay. We are all humans, but just try to be consistent as much as you can. So I think you just have to lift your time as well. Yes, Guru, you can just go to the PYTs as well. Given in the doc tutorials app, we have got PYQs as well as the recall videos. And just one thing I just want to tell you is one student is asking, Dr. Sandeep, is CPR workbook enough for revision? So even in our academic WhatsApp groups that we have got for the online live batch as well, so students were asking me, sir, how to plan the revision according to CPR? Because, when you just near the exam, I'm sure that many of you will be having self-doubts how to cover. Let me just take my subject like medicine. Okay, medicine is vast, sir. How can we concise and revise it? That is how CPR actually can help you, which is the critical points revision session by doc tutorials, which we are doing in online format as well as offline format. Now, I'll just tell you one thing about CPR. I'm just taking my subject like medicine. My aim is not to give you or bombard you with some new information and make you learn that as well in addition to the main notes. No, that's not what I aim. What I am trying to do is, like, for medicine workbook of CPR, you will notice every system I have made into tables. You will only see tables. You will see tables for neurology, cardiology, like say investigation of choice, drug of choice, scenario given, and then diagnosis. What are the buzzwords? That is how I've made, including the most important images. So every faculty has taken utmost care to bring out the best concise version of their own subject in the appropriate way. Every faculty will have their own style, because that style will be the most appropriate for their own subject. And you will be definitely enjoying the CPR. So I'll just show you how we are just planning the CPR. Just let me just take it. I think no. Yeah. Dr. Gayathri, just tell me if you're able to see on big
Yes.
screen. Okay.
Yes, visible.
So just want to tell you that for the students of doc tutorials, I'll just quickly summarize in 3 minutes, how you can just best utilize. Number one, okay, for the online live batch students and also the Lexia students who are going to attend the online live CPR. This is a well-crafted 60-day live revision program wherein every subject, we'll be doing it in 3 days. For example, the first test is that of medicine. There is already a structure for this program. We have got a timetable as well. So on 20th Feb, we are starting with the program. So day 1, you will have the CPR of that subject. For example, 20th Feb, I'll be teaching you this medicine 1 day, concise, crisp revision, every system concised into tables, right? Day 2, you will have an exam. All questions I'll be putting. There will be a test. Day 3, there will be a discussion. Similarly, you will have a proper structure wherein all subjects will be covered, followed by cumulative test as well. Now, the good thing about this is that, you can align your revision according to the CPR. Okay. Like suppose those 3 days, Feb 20, 21, 22, your brain, heart, kidney, liver, everything should have medicine only. Okay. Forget about OBG, surgery, you should think about medicine only. And then as you move to the next subject, think of that subject so that it will give you that push. I am sure that, you all are looking out for that push, because sometimes what happens is that during this phase, sort of fatigue comes in, you're not able to find purpose in putting effort again and again. NEET PG dates not out. You're not getting your desired scores. GT scores are stuck. Problems will be there, but you need a push. You need momentum to go forward. And I think, if you go through the timetable, which I've shared in the groups as well of CPR, it will actually help. The same program, we'll be doing it in offline as well with subject specialist, which will be happening in Delhi, Lucknow, Hyderabad, Chennai, and Trivandrum on these dates. And, the timetable is rolled out for those programs as well. So in case, you want to attend these sessions, you can very well attend. Again, I just want to tell you, this is not to bombard you with new information. Okay, Dr. Gayathri, how have you planned your, the revision session for OBG, and can a student rely on that particular workbook? Because students will be given the workbook as well, color workbook, whether it be online CPR or offline CPR. So how have you planned the OBG CPR sessions, and can students rely on that, especially for the last 10 days? The last 10-day, study plan that we were talking about, can the students rely on that?
Definitely, sir. So much effort and time has been put in so that we are able to concise all these 6 days of session as such into 1 day of session. Majority, all the points, like in the same way that you see in the main videos, the same thing would be there, but it will be very concise to the point, and all the core areas are going to be covered in the CPR as well, so that you get maximum out of this in 1 day itself. And again, the best thing is next day itself, you are assessing yourself how it is going. There would be up to 100 questions on the next day, which we are going to again review on the 3rd day. So this will give you a wholesome, holistic approach as such. You are going to have a complete revision in the first day, followed by practicing the question and analyzing. Because even after hearing these things, sometimes there is some problem in applying those information. That's why the very next day you are going to have the exam, and on the 3rd day we are going to discuss all those core areas where we can again interact, or any doubts or questions is there, you can get it cleared as well. So all the points will be included in the workbook. It's a colored workbook, and all the areas are included. So definitely you can just go with it and keep on revising those things.
Right. And just to quickly answer a few queries in the chat before we actually wind up. Number 1, any advice for working doctors? I know in your case, the limiting factor is time. Never aim for perfection, but please, progress is important. You may have interruptions, you may have duties. That's okay. If it is possible, you can take a break and then focus on the INI-CET exam. But if not possible, you will have to work. What I would suggest is, don't aim perfection, but make sure there is a progress. Make sure there is a progress, and whatever time you get, you put effort in a channelized manner. Okay, right. And specific revision from main notes is enough, or you have to make separate notes? For revision, I said, if you are following doc tutorials, I think your CPR can be used as a revision tool. And I think, you can go through that multiple times, and especially you will realize the value of that in the last 10 days before exam. Okay, right. Can you share the high-yield topic list? I think, some of us have already made the high-yield topic list. I think Dr. Gayathri, before the INI-CET last time also, you had made that list. I think I would urge everyone to just go through some wonderful content that Dr. Gayathri is sharing in her academic page as well. You can just go through it. Once you take a break, I'm not telling be in Instagram itself, but once you take a break, you can just go through her reels, where she's putting some good academic content in a very concise and crisp format, and you can just follow that as well. So I think Dr. Gayathri, in your Insta page as well, you have put the high topic list as well, if I remember correct.
Yes, sir. And we recently had a 10-minute video with sir as well, where we had discussed the most important areas.
Yeah. And that video is there also in YouTube. The most important, correct. So I can share that video also in the WhatsApp groups as well. Okay. Then it's medicine CPR enough. Abhishek Reddy, after reading main notes, yes, enough. But do the test and discussion as well. Okay, right. And if I haven't done a subject, then how do I analyze after giving GT? Look, GT is just not for you to analyze after having done all 19 subjects. GT is a progress tracker. With every subject that you are done, I'm sure your GT score should increase. Maybe let's take, you are doing online live or offline and you're done with 60% of topics. Now in this month and next month, which, most of us will be covering the topics, by that time, your GT score should come up. But don't wait for an ideal moment. There is no ideal moment. The best day to give a GT is today. That's what I would say. So please don't postpone. You will have to give GTs and you will have to assess your progress.
Okay. Even if you have done only 50%, the rest 50, at least you are understanding which are the core areas, important areas, because same things are asked in GT as well. So don't wait for everything to get completed. Whatever 50% is done, you analyze those things. Whatever is not done, from there you understand those areas and at least you can read upon that. Or maybe when you are reading later also, your mind will register those areas which are high yield much better once you practice it. So don't wait for everything to get over to start doing.
Like one thing I just want to ask you, I've also answered to students this, but I would like your perspective as well. I get a lot of messages from the students right now that they're getting stuck in GT scores. Like many of them, stuck in 110 range, 90, 100, 80. So what would you have done, once, if you were in their place, stuck GT score, what is your take on this?
Sir, I would say whenever the store is stuck, we have to analyze ourselves regarding the preparation. First, look at the questions that went wrong and you are going to analyze what type of questions are you making mistake. Sometimes 10%, every GT will have 10% area which are very rare, which is not that commonly asked. You can have a piece with those areas. There will be some areas which are very commonly asked, which is very conceptual, which you had made mistake in that. In those areas, you have to analyze why did that concept go wrong, whether the way you learned something was error in it, and if at all you are seeing at a very clinical conceptual management type of question is going wrong, just go through that area thoroughly. Even if you are not getting the entire gist from the rapid revision video, you can even refer back to the main videos as well for those conceptual questions. There will be again 30% of those questions which you made error, which is made more based on factual information. Maybe you have learned it previously, now you forgot that kind of information. Those things I would say you are going to improve with repeated revision. So whatever it is, any GT that you give, you have to analyze your mistakes. Why did I go wrong? That question should continuously be there in your mind. Analyze the type of mistakes and try like making it correct the next time, and maintain this mistake diary. So many times, even when we take the classes, when we ask some questions, we know there are some areas from where students do make mistakes, and those mistakes are often repeated as well, and that pattern often repeats. So you have to understand that, and you have to maintain this mistake diary, which also you are going to repeatedly revise as well. These things are definitely going to help you if you follow this.
And Gayathri, like suppose if I'm a student, I'm just getting around 110 correct. Some of my friends are getting 130, 140, 150, 160. Do you think I stand a chance for INI-CET, or I should prepare for NEET? What is your take on that?
Definitely you should not feel that you don't have a chance because or nothing like that, because you never know how the exam goes in the final exam. It's only like giving you a guiding light, like how to change your preparations, like just a reflection for you to understand your preparation and modify it. Don't take it negatively. It doesn't matter. We have seen students who have been getting low scores initially, but who did exceedingly well in the INI exam. And as sir told, INI is one exam which is very much predictable. If you focus on on those previous year topics. I won't say previous year questions, previous year topics, and go into a bit more depth into those topics. That gives you a high yield. Like, for example, the HPV vaccine. Those things are repeatedly asked. You would see that 2 years subsequently the same question came, quadruple marker. 2 years subsequently it was asked. The INI has a very predictable type of questions. It's not much of that rote learning kind of information. They give more of that clinical scenario based questions, which more of conceptual knowledge, and those bank of questions that they repeat often, it's often get repeated as well. So understand those areas and never think or don't compare yourself with your peers. Everyone has different this thing. It's all matters, just like the turtle as well as the rabbit story, which is the only important thing is you should progress daily. That's what's most important. And especially someone had asked regarding like when they are working, how to prepare. I would say momentum is most important. Some days, 2-3 days, we don't learn anything at all. Then next day when we are going back, we don't get that momentum. So whatever, even if it is a busy day, at least find some time so that you are just in touch with it. Like during my internship, this is what I used to do. Many times it will be very hectic posting. So during that time, at least I used to maintain some flashcards in my phone or something, image-based things would be there in the phone. At least those things, maybe when we are walking around the lift or somewhere, we'll just discuss and learn a bit of it so that I'm not feeling I'm completely out of track from the preparation. Main thing is you stay in track, maintain the momentum. There will be some days where you are exceedingly doing well. There will be some days where you might not be able to give you 100%. But what is important is you give it daily and don't compare with your peers. Yes, just try to be the better version of yourself. That's it.
Right. I think that's absolutely right. Being the better version of yourself. And again, as Dr. Gayathri said, try to identify the previous year topics. Just like Dr. Gayathri said, an example, let's take, for example, cardiomyopathy's topic in medicine. Time and again, they ask about hypertrophic cardiomyopathy. Then you will see another question being asked from arrhythmogenic right ventricular cardiomyopathy. The question with that epsilon wave finding was asked. So you can predict, okay, cardiomyopathy is important. Question has come from hypertrophic cardiomyopathy. So that means the topic of cardiomyopathies is important. It's not that you just focus on hypertrophic cardiomyopathy. A student should actually understand that the next question can be from a very closely related topic, and that is very important. And Dr. Gayatri, I would also urge, it's also important to have a calm, relaxed mind as well, isn't it? Because, stress can be there, anxiety, apprehension, but it's about living a day peacefully, and you're going to sleep, happy. And I think that happiness has to be the effort that you have put in. Just tell yourself that, look, I tried my best today. And just like Dr. Gayatri said, don't compare yourself with others. Maybe your friend is able to put 15 hours, 16 hours, and you're only able to put 10, 11, or maybe 8, or whatever it is. But whatever time you spend in your own capability, make sure that you're putting your best effort. That is what we want to tell all our dear students. And never rule yourself out of the game. The game is still on. It's about consistency and maintaining the momentum. So we wish all our dear students all the best. And we'll be definitely coming up with much more sessions by all our faculties, Sandeep sir, Dhawan sir, Vandana ma'am, Rajesh Kaushal sir. All the faculties will be coming up with sessions very soon. And do stay tuned for much more interactive sessions. That's it. Thank you so much, everyone, for joining. Dr. Gayatri, thank you so much for your valuable advices as well. So thank you so much, everyone. And in case you are having any doubts post the session, you can just message me or Dr. Gayatri in Instagram. And my Instagram ID is dr_Rahul_Rajeev. And Dr. Gayatri?
OBG_OBG_ Gayatri.
Yeah, okay, right. Dr. Gayatri has so much of information to store in her head, and so that she forgot her Insta ID. That is understandable, when people have to remember so many things. Okay, that's completely understandable. I have not a free space left, so that's okay, Gayatri.
OBG_with_Gayatri.
Okay, that's it. She made a mistake again, so that's okay. So thank you so much, everyone, for joining, and stay tuned to this channel. Thank you so much. Bye-bye.